I'm Dr. Kathy Sawhill, and I work with the Wellness Center PDX, and I would like to talk to you about our program, our Semaglutide program here at the clinic. Our program is a little bit different. It's not online. It's something where you come in every week for your injection, and you have a provider guiding your care weekly. Any of the negative effects that people experience from the medicine, the semaglutide, it can be addressed. Just bring whatever you're experiencing to the visit, and we can, the doctor, and we can address that. As a naturopathic doctor, I have a lot of tools under my belt, and also I can prescribe anti-nausea medicine if it's indicated. The glutide program, we started out doing it so that people would just get their medicine and do the take-home injections and self-inject. We found that people were getting frustrated. They didn't feel like they were getting much guidance, and they were having negative effects like the nausea and fatigue, and just gave up, really, most of them. So we switched it so that people would come in weekly and get an injection. And this has given us pretty much 100% success rate. Now you just drop in on the day that you've decided is the day of your injection, and a medical assistant will help you out and consult with the provider, and then your personal guided program journey through this amazing weight loss and reset, metabolism reset, mind reset journey is that this medication is a game changer. It is not only resetting metabolism and, of course, helping people achieve weight loss goals and getting in shape goals, but it goes beyond that. It is currently being studied for its activity in the brain, because it does it does make this a very easy procedure, as far as there's no deprivation. Your appetite really does decrease, and it's not just because you're eating less, it's because you're satisfied sooner, so you don't need as much food. People have joked that their grocery bill goes down, and that is definitely true. Is it safe? Yes. It's a very tiny dose of medicine. It's a compounded medicine that we use, and it's a peptide. The actual medicine is a peptide, and a peptide is a morsel of an amino acid, and an amino acid is a morsel of a protein. And what this tiny little morsel does is stimulate GPL-1. And GPL-1 is a hormone in our gut that we all have, and it regulates insulin release. So what we're doing is we're stimulating a little bit of insulin release to mobilize the fat. What we know now about cortisol's action on insulin is that it literally packs fat into the muscle. So that's insulin resistance. That fat is very difficult to mobilize once it's been put into the muscle. And that is where people stall out with their weight loss programs. It's also where people develop other issues that you don't want that come from insulin resistance. And it's also what semaglutide addresses. So the program is a 3-month program, and the reason for that is introductory. After that, you can go month to month if your goals have not been met. However, we ask for a commitment of 3 months initially, because that's about how long it takes to really see the amazing effects. You know, we'll know within a month if the medicine is going to work for you, and then you'll see results little by little. But right around that 3-month mark is really where people are just like, wow. So, yeah, there's no reason not to do it. There are some contraindications for this regimen, but because this is a doctor-guided program, we can make individual assessments and determinations based on your individual health history rather than the whole rest of the world. As a naturopathic doctor, I'm also looking for people to make that shift to lifestyle changes. It takes 3 months to set a habit, good or bad. It takes 3 months. This is what our research shows. Our meaning human. So we have that time for people who have been, eating a lot of sugar or whatever stuff they don't want to eat. We have that time to set a new habit of ways to eat that are more nourishing for your body. And then for those who are not doing exercise, we have 3 months to get into this habit, a program, a lifestyle. We're designed to move. So exercise pretty much is going to help with every issue that humans suffer with, whatever type of exercise you can get. So yeah, we can get people on a lifestyle program. We have a fitness instructor who works with us who will do a body mass scan before and after to ensure that you are gaining muscle mass, not losing it. And our fitness instructor also is nutrition. She does some guided nutrition plans for people as needed. If you want that, definitely ask. The program has a lot of perks apart from just the medication and the doctor guided visit and having someone else inject it for you. There's discounts with a lot of the other services that we have here at the Wellness Center PDX. Now, my personal story. Well, I was a cynic. I was against another weight loss fad. I've seen a lot, and I've studied them, and I have theories on why some work and why some become fads. This semaglutide, though, is unlike all the others. This is a game changer. Now, all the other diets, they will help reset the metabolism, and they do help bring down inflammation for those that, it works for. Absolutely. Anytime you change what you're eating, you're going to bring down inflammation. What's different about semaglutide is it has an action on the mind in that it stops a lot of that chatter about food and the guilt and the shame that the media has put on our culture around food, around weight, around health. So, and it really, what I love about it is it gets people back into their bodies. A lot of people in this country don't really know what true hunger feels like. So you get to experience true hunger because your appetite is so decreased that when you're hungry, and it feels good to eat rather than, something that you do to escape or whatever. Humans have such a relationship with food, and it's different for every individual. And that is really a place that it's good to also focus on and work on, because depending on who you are and what your goals are, things change, and the way people receive you is different, and how you see yourself in the mirror. So these are all areas that really, with a doctor guided visit, it really helps to have someone coaching and staying on top of that with you, and making sure that you're getting all of the care that you need from here and from outside providers. So if you have any more questions, please don't hesitate to come in and ask or give us a call. The number here is 389-5545. Thank you. Look forward to meeting you. And congratulations for making this decision.